everyone. I'm here today to talk to you a little bit about chapter 24, and that's nutritional needs of the newborn. First thing that we're going to take a look at is the advantages and disadvantages of breastfeeding. I think your textbook does a really good job of going into a lot of detail, and without question, I think the overall feeling is that breastfeeding is always best. So I've done a little bit of footwork here and put these a couple of columns together for you. Um, just to add to this, though, a couple of things, some caveats. First one, to be successful at breastfeeding, studies have showed that we need to get the baby to breast just as soon as possible, hopefully while still in the recovery room. It is also recommended that no supplements be given to the baby for the first 4 to 6 months. Choosing what best way to feed your baby based on nutrient needs. Um, Fluids in the first 2 days of life, the newborn needs 60 to 80 cc's per kilogram of body weight. Either method of feeding provides sufficient water for a healthy newborn. It is not necessary to feed water to newborns. The other nutrients needed are those that we all need, like carbohydrates, fat, protein, vitamins, and minerals. Research demonstrated that breastfeeding is the best feeding choice for human babies. However, the choice does belong to the mother. As nurses, we are responsible to educate and support the patient, whatever her choice may be. Mothers should not be made to feel guilty about her choice, whether it is to breastfeed or to bottle feed. There are some instances where breastfeeding is contraindicated, such as newborns diagnosed with galactosemia, mothers that are positive for human T-cell lymphotropic virus types 1 or 2, those with untreated brucellosis, women with active TB or herpes, or those that are positive for HIV. Other mothers that perhaps should choose to bottle feed are those that have a systemic illness, those mothers that are on special medications, those mothers that are receiving chemo, and mothers who have an aversion to breastfeeding. Hi there. Okay, we are going to talk a little bit about breastfeeding. On this slide, the amount of milk produced has nothing to do with size or shape of the breast. Women's breasts all have about 15 to 20 segmented lobes. Prolactin from the anterior pituitary gland increases milk production, while oxytocin from the posterior pituitary gland is responsible for letdown or milk ejection reflex. Recall that oxytocin is also used in labor to either augment or induce uterine contractions to assist with delivery. This is why mothers complain of afterbirth pains while nursing. While it is uncomfortable, these uterine contractions felt during breastfeeding assist with involution, thereby decreasing risk for postpartum hemorrhage. Breastfeeding is based on supply and demand. The more the baby feeds, the more milk mother will produce. So frequency and length of feedings affect overall milk production. So it makes sense. The more a mother supplements with formula, the less breast milk she will make. When we look at how often a baby should breastfeed, we are looking at 8 to 12 times in a 24-hour period. It seems like that's a lot, but human milk is absorbed much quicker than those babies that are fed by formula. We should be feeding about 15-20 minutes to each side. However, we're now moving towards teaching the patient to be more cognizant of the signs that the baby's giving versus than watching the clock. So the breast that is offered first at any feeding should be the breast that was used on the last feeding. Let's talk about breast milk specifically and its uniqueness. Colostrum, also known as foremilk, is excreted initially for the first couple of days of life. It is a yellowish fluid that has the greatest amount of carbohydrates and protein. Colostrum is long on quality but short on quantity. White milk, or also hind milk, is produced around day 3 to 5. It varies from patient to patient depending. This milk has more of the fat content. With the production of white milk, the patient may feel a fullness in her breasts and she may experience a low-grade fever. Antibodies passed from mother to newborn via breast milk last about 3 months. With either form of baby feeding a mother chooses, as nurses, we teach the patient to watch their babies and not the clock. Some of the things that you're going to see, what we would call feeding readiness, include babies putting their hands or their fists to their mouth and or sucking their fists, the rooting reflex, and just generally making mouthing noises or mouthing movements. So there are some positions that are taught to our patients, and hopefully they try them out. Moms do end up getting into 2 or 3 that are their favorite, but initially they need to at least know what their options are. And positioning plays such an important role that a scoring tool was developed to assist with consistent assessment of how well the newborn is latched onto the breast. It is actually called latch. So it stands for L for latch, A for audible. Audible, can you hear the baby swallowing? T is for type of nipple, so what kind of anatomy does the mother have? C stands for comfort level of the mom if once she gets the baby latched on. Does it hurt? Does it not hurt? And H stands for hold, which is how is the mother holding the baby? What is the position and how well is she comfortable with that? Mothers often worry about whether or not their baby is getting enough. That seems to be, from coast to coast, a traditional question. Indicators of effective breastfeeding include a feeding diary. So moms should be writing down how long the baby's nursing for, what time they start, what time they stop, those types of things. If the baby is urinating, so if we are seeing those minimum P's per 24 hours based on the age, we're doing good. And does the baby seem satisfied? In other words, after the feeding, does the baby fall asleep? Does the baby stay sleeping, a fair amount of time? Those are good indicators that the baby is getting sufficient feedings. Supplements should not be offered unless medically necessary. As was mentioned earlier, offering supplements on a regular basis will impact breast milk production and ultimately breastfeeding successfulness. Okay, just a couple of things I'd like to talk to you about today. You can go ahead and read up on them further in the textbook. They're located on page 646 through 653. Sleepy babies. Well, the first 2 or 3 days of life, mostly the first day of life, babies are generally quite tired. They wake up, they're wide awake right after the delivery, and then after they get that first good feeding in, they promptly go to sleep. So we know that we're going to have to be waking them up at least for the first day of life. What are some of the things that we can do? Well, we can try unwrapping them. We can try changing their diaper, just a couple of things. A fussy baby. A fussy baby, if we have a baby that is so fussy that they are not able to latch onto the breast or they're refusing to eat, the first thing that we need to do is get them calmed down. When we look at slow weight gain, normally we can see that a newborn may lose 5 to 6% of their birth weight. Anything over 7% needs to be investigated. Jaundice. Now, we've talked about jaundice here in the past, but early onset jaundice can be associated with insufficient feeding and stooling, and we'll talk some more about that in the next chapter. When we're looking at preterm infants, whether they're late or early, we know that moms need to be pumping their breast milk and storing them because this is like liquid gold and it's most important for the preterm baby to get all the antibodies that they can out of that breast milk. And breastfeeding multiple infants. Most mothers are able to produce adequate milk supply for multiple infants. This should not be a concern. It's an interesting little slide. Very, very, very cute. Okay, breastfeeding, some common problems. These are things that we can see frequently in the obese setting. Nipple soreness is directly related to how is the baby latching on. So the positioning is most important. A mild amount of nipple soreness is quite common. The key is to accurately position the baby's mouth consistently, covering as much of the mother's areola as possible. Engorgement. Engorgement is caused by a significant amount of milk production. It usually occurs somewhere between 3 and 5 days after birth. What we see is milk production that exceeds storage capacity. So edema impacts that amount of milk flow and the breast gets engorged. It's a temporary condition, and what we do is we recommend that the mom feeds at least every 2 hours, and she should massage or apply warm heat prior to feeding. And the plug duct is not all that different in that what we see is a swollen breast here, but more due to incomplete evacuation or too tight of a bra. So again, apply a warm compress and feed soon after to ensure adequate emptying. Mastitis, I'm going to talk about on the next slide. Inverted nipples, what we use for those is shells and put the electric pump on and pump just a little bit prior so that we get the nipple to stand out prior to putting the baby to breast. Postpartum mastitis. Okay, mastitis is the inflammation of the breast. It can occur as early as the 7th postpartum day. We see flu-like symptoms with localized breast pain and tenderness. Predisposing factors are inadequate emptying and sudden decrease in feedings. Sore, cracked nipples also provide a good portal of entry for bacteria. So what do we do? To prevent it, we avoid trauma by proper placement. That includes breaking the latch correctly, washing your hands, airing out the areolas, vitamin E cream, and always begin breastfeeding with the unaffected breast. Promote continue to feed unless abscess forms. The other thing that we can use is cool for comfort and heat to breastfeed. Treatment includes antibiotics, analgesics, antipyretics, and of course breastfeeding or pumping frequently to promote breast emptying. Bottle feeding. Well, let's talk a little bit about bottle feeding. And once again, I want to mention it is important to support our parental choice. Breastfeeding, while all the good that it does, it is not a good option for someone that is adamantly against it. What is most important is that we focus to emphasize feeding as a close time, no matter what feeding preference the parents chooses. The responsibility of a nurse, once again, is to make certain the mother is informed in assisting her with her choice. A couple of instructions will assist our patients with bottle feeding. They need to be doing the same thing, which is to observe for feeding readiness, not the clock. Never prop the bottle up. Always keep the nipple filled to decrease air intake. Always burp your babies well. And it's not necessary to boil water to mix with dry formula unless bacteria is suspected. Typically, babies will eat every 3 to 4 hours, about 15 to 30 cc's to start. 30 cc's is, in my opinion, in my practice, still a lot for the first day. Non-nutritive sucking should be encouraged in those babies, and it is self-consoling. Growth parameters. This slide is to just indicate to you or show that it is normal to have some loss after the first day of um, after birth, that first day. And the reason is babies are not eating as much in the first 24 hours because they're sleeping so much. When we have a breastfed baby, we know that they're getting high quality colostrum, but they're not getting a lot of it. So breastfeeding babies gain their weight slower, but bottle fed babies have been shown to associate with obesity later in life, especially if they are overfed. Okay, hope that helps you some. Just let me know. Thanks. Bye.